And I'm really enjoying this today, and I'm very much in support of our governor. Look, if our governor fails, our state fails. We need our governor to turn the state around, and I'm there to help him. I was at a press conference with him today because I came out in support of sending troops to the border of Texas, which I think is absolutely necessary. So I want to talk about this Blue Cross Blue Shield Elevant issue, and I'm coming to you from the perspective of a practicing physician. I'm still licensed and insured. In fact, I can take your credit card if you've got a sore throat or a headache today. We happily provide care. But I've been in practice and been in private practice for 42 years. And my practice still continues, and I have practiced from time to time in intervals. When I left the White House, I went back into practice part-time because we lost one of our providers who was deployed unrelated to COVID overseas as a reservist. So I'm ready to go, but I still feel the pain that many doctors and patients feel across the state. So let's talk about this issue.
Doctor, hold that mic a little closer.
Yes, okay. Can you hear me better here? Okay. Yeah. So I come before you today as a new state treasurer, but perhaps more importantly as a practicing physician who has spent a lifetime as a family physician in the city of Minden, Louisiana. Like thousands of other physicians across our state, I have spent the past few weeks studying the proposed sale of Blue Cross to an out-of-state for-profit company named Elevance. I'm perhaps uniquely qualified to speak to you today because I'm the only medical doctor in state government who has been elected statewide and currently serving. In the world that seems heavily divided in almost everything, physicians of Louisiana are overwhelmingly concerned that the proposed Blue Cross deal is very bad for our patients and must be stopped. As you know, they've come out, the Louisiana State Medical Society, as well as many of the specialty societies have come out, and many others, even smaller societies, totally opposed to this sale. In life, an important principle is if it ain't broke, don't fix it. And of course, you've always heard that what we go by as physicians is that first, do no harm. And that's certainly something we need to consider here. And remember that despite the fact that we have many problems, especially in insurance, a bright star in our state has been health insurance. Blue Cross Blue Shield has served us well for many decades and continues to do so. And I can speak as a patient and as a physician, as a provider on that. I feel like that I can be very truthful in letting you know about that. So the plan to sell Blue Cross is opposed by the Louisiana State Medical Society and many professionals, as I mentioned just a moment ago. And it's all these major groups: family physicians, obstetricians, pediatricians, ophthalmologists, surgeons, orthopedic surgeons, doctors of all stripes. Even the parish medical societies have come out across the board. I can't speak for every one of them, but from the published information we have, most of the large ones have come totally against it, including Jefferson Parish. So why? So we know Blue Cross has had a great record as a mutual company. You know what a mutual company is? The subscribers actually own the company. And so there's an accountability there that's very important. If you sell or you privatize, then that accountability is totally lost. And we know that this has been going on in our state for over 100 years. It's been a mutual company. Blue Cross is owned by the members and run for their benefit. There's no profit takers in this. There's salaries, yes, and there's overhead costs, but there's no slick New York hedge fund that's out there making money on our Blue Cross Blue Shield mutual fund. Blue Cross is owned by members and run for the benefit. And who are these members? It's small businessmen, women, gas station owners, barbershop owners, employees of companies like Walmart. They all own a piece of Blue Cross Blue Shield. The folks operating Blue Cross day to day are more than 3,500 of our fellow Louisianans who live and work right here in our state. They are from places like Bunkie, Homer, Denham Springs. These are the people making decisions every day about our medical care. They live among us and have the same Blue Cross coverage and the same providers we do. Perhaps that is the key to why our patients love their Blue Cross coverage. And our doctors feel Blue Cross treats them fairly. And I can tell you, we've had a lot of problems with a lot of insurance companies, but Blue Cross has never failed us in terms of our reimbursements. Now, you might say, well, who cares? You're a doctor. Maybe you make too much money anyway. I hear that sort of thing. It isn't true, of course. And what I have to tell you is that if doctors can't meet their overhead, they're going to go out of practice. They can't provide the care to you. Today, more than 1.9 million people in Louisiana have Blue Cross. More than half of all people with health insurance. But the Blue Cross we know and love will be gone forever and will never come back if this is so. It will no longer be a mutual fund owned by the members. The people administering our health insurance will no longer live among us in Louisiana and have the same coverage and relationships that we have now. The underlying reason for Blue Cross's existence, providing affordable health care, will no longer exist. Blue Cross will be owned by an out-of-state, publicly traded corporation. The owners will be people outside Louisiana and even outside, in many cases, the United States. It can be Chinese banks, Arab sheikhs, probably will be. It can be a foundation from Harvard University and hedge fund owners as well. Their interests will be maximizing profits day in and day out. They don't know you and they don't care about you. They only care about the bottom line. Now, don't get me wrong, I'm a capitalist. I believe in the bottom line. But there also has to be accountability, and these people will not have the kind of accountability that we have today. Their interest will be maximizing profits day in and day out and get back somehow the $2.5 billion that they're going to spend to purchase this. It's not going to the subscribers, the mutual owners. That will make it completely different animal from the Blue Cross that we know today. The Senate Health and Welfare Committee and the Senate Insurance Committee held a hearing on this proposed sale on Monday. How many here saw it?
I was there.
Okay. It was very eye-opening. It was very, very eye-opening. And you're going to hear more details from another speaker here in a moment. One of the things the senators brought out was the poor record of elements in paying claims. And the large number of times elements has been found to have wrongly withheld and denied claims. This has resulted in elements being fined tens of millions of dollars for violating the rights of policyholders. These fines do not compensate the people who are denied medical care. It only goes some other place and not again to the people that are being served, or in this case, disserved. Who will be making our health care decisions? Yesterday, I had a conversation with a high-level official of the Louisiana State Medical Society. His comments on the proposed sale brought together very concisely why your doctors are so opposed to this deal. What they did is they surveyed doctors across the country in states where this has already occurred. So the question I posed was, when all is said and done and Elements is in place, doing this again as a for-profit company, corporation, and setting up this foundation that we know very little about, what happens? What are the doctors and the patients experiencing in these states? He told me 4 things. Number one, he says basically nothing happens for 2 years, so watch out for that. You'll get the promise that nothing is going to change, and that's true at first. So he said, number one, jobs are absorbed or moved to a central location and not usually in the same state. Doctors notice lower or not growing reimbursements for their care, make it difficult to stay in practice with growing overhead costs. And I can speak personally on growing overhead. I know you complain about the growth in your premiums, but the cost to run a medical practice today and the escalating salaries that have to be paid, You've got to keep up with insurance reimbursement or you're going out of practice. And let me say parenthetically that while this sort of thing has been going on for the last 20 years, in the early 2000s, 75% of physicians were independently owned their practices. That is now reversed. It's 25% today. And the reason is that doctors' reimbursements have been so chiseled that many of them could not sustain their practices, believe it or not. Working around the clock, night and day and weekends, they still can't stay in practice because many of the things necessary in terms of reimbursement have been taken away from them. And they're forced to be an employee of a hospital or a large institution. Now, I have nothing against a doctor or any healthcare provider working as an employee for a hospital or an institution. Absolutely nothing. But I think it should be his or her choice. Because your style of practice depends a lot about whether or not you want to be an independent practitioner and primarily answerable to the patient, or do you want to be answering to the institution? That's very, very important in healthcare. Number 3, patients and businesses that employ them notice that premium rate increases accelerate over time. And number 4, patients complain that coverage for their care is too often delayed or denied altogether. Elements will have to show a profit plus get back the 2.5 or whatever that number is that they're paying for this. They're not going to do this out of the goodness of their heart. That money has got to come back. The money that's going to be purchasing dollars, which then get offset into a foundation, well, they still want that money back. And where are they going to get it? They have to go to the premiums. That's where they have to reduce costs. Now, look, I believe in scaling, and they do talk about this, and scaling can be a good thing. That is to say, if you automate things more, you digitize things, you can reduce the cost of overhead. The problem is that really going to be passed along to the policyholders? Or is it going into the pockets of profiteers? Good question. And that's why we have to look at where this has occurred before. What have they done? If they had a great track record, well then maybe that's a good thing. But so far, the track record does not look good. Elements, let's see, many physicians in private practice will likely be forced to become employees of large companies, as I mentioned. Payments to doctors will be disputed, delayed, and decreased. Coverage of your medical bills will be decreased. Higher insurance premiums, less coverage, and poor quality care is the likely end result of that. So if it ain't broke, what do we need to fix it? It's a once-in-a-lifetime decision. Once this thing is done, it is done. It never gets reversed. There will never be the Blue Cross that you know today. So I would like to join my fellow physicians who have come out in opposition. I urge that you should vote no on allowing this purchase to go through. I do not think it's in the best interest of the citizens of the state. I do not think it's in the best interest of physicians, and physicians will be the first to tell you this. And if it's bad for physicians, trust me, it's bad for patients. Because what it means is there's less and less resources for your doctor to provide care for you. And don't forget the promise, the famous promise from President Obama with Obamacare. If you like your doctor, you can keep him. Well, that didn't turn out to be true. If you like your doctor, you can keep your doctor. And I would suspect here, if you like your doctor and this thing gets sold, you will not keep your doctor. So thank you very much, and thank you so much for listening to what I have to say. I'll take a couple of quick questions.
So I'm trying to understand the pressure. If it goes to a publicly traded company, the stockholders are going to demand profitability from that company. So why is there this presumption that the new company will neglect its customers, treat them badly, then they'll leave? That's not going to drive up profitability. I would think the pressure from stockholders to make a profitable company would result in better service and better care for the patients, because that's the incentive for them to stay. I mean,
What you outline is true in a true free economy. Okay, healthcare is not a free economy. Okay, for instance, doctors don't negotiate their rates; they're dictated to them. We're paid what we're told to be paid, and that's it. This is I would say, a highly over-regulated economy. And what's happened is the profiteers have taken advantage of it to, again, in many cases, reduce the quality of care or the abundance of care and receive compensation for that. I'm all for publicly traded companies. I myself have invested in publicly traded companies. And again, in a free economy, it works great. But healthcare is not a free economy. There's all sorts of regulations and uneven controls in it that allow people to take advantage of it. And so, but I don't even judge it on that. To me, the way to judge it is, how is this doing in other states that have gone this direction? And what I'm told is it's not going well at all. So that convinces me that this is not going in the right direction.
I would assume, based on that, along that line, that the rates are gonna go up because you have a different company who paid $2.5 billion.
Right.
And they're gonna go to the insurance commissioner and say, we just bought this company, we've got $2.5 billion in it.
Right.
We need our rate of return on that investment.
Right.
Just like every other insurance company. So the insurance commissioner is not gonna give them any kind of special deal if they go along with what you're doing now. I don't see how rates can't go up for Blue Cross Blue Shield members because they're in a completely different, they got a completely different base of cost to deal with the new insurance, i.e. $2.5 billion versus Blue Cross Blue Shield, which probably has little or nothing, or small because it's been here so long.
Exactly.
So I don't, even if the care is the same, if your cost, let's just say doubles or go up 50%, you're gonna be looking for another insurance.
Yeah, I mean, somewhere that $2.5 to $3.5 billion has to be paid back. There's a debt service, I would assume, or something. And
They gotta
because,
get a return on their
but
investment.
whereas that capitalization occurred 100 years ago with Blue Cross. So you could only expect that the cost would have to go up. But again, look, you've heard me say before, the best predictor of the future is past experience. The experience is not good.
Yeah, I was listening to News the Fall today, and he had the governor on for, and he asked him something about that. And he said that he kind of pushed it off to Ralph Abraham, who is going to be on those shows Monday. And so, have you had a chance to talk about Abraham? Because I know he's a doctor like you, and he probably has the same feelings on costs like you do.
Yeah, remember Ralph Abraham is former congressman like me. He ran for governor, but he got elected. And he's now appointed head of LA. So I have not had an opportunity to speak with him. I'd love to hear what he has to say. But the first people I wanted to go to is my colleagues. And also the reflection upon their colleagues across the country and the inputs they've given. And there's just uniformity across the board. Doctors in Louisiana don't think this is good for Louisiana in any square. And look, we've got institutions in Louisiana that I don't care much about. In fact, I'll tell you, I'm not a member of the American Medical Association, and I oppose just about everything they do. In fact, very few, I think the percentage of members of the AMA who are actually doctors is down around 20% of the entire population of doctors. And the reason is they don't need our subscriptions, our premiums for membership. They get it from the CPT code book, which gives them hundreds of millions of dollars every year. So they go off and do whatever they want to do in a very progressive way, which is why we're not on board with them. But the Louisiana State Medical Society is just the opposite. These are people who care a lot about what you think and what doctors think, and I have the highest regard for them and every other specialty society that we have here in Louisiana.
Yeah.
So, all right, very good. Thank you so much, and God bless. And you're going to hear more, which I think will be eye-opening.